just this whole scenario, like it's you got to pinch yourself sometimes and ask, like, am I really still in Canada anymore? Just all the stuff that's happening, we're watching it left, right, and center. So we are so happy that Dr. Mel Bruchet is safe, and you know, you're a good man. You've got him a lot of support. I know he has support, but it's individuals like yourself that are going to keep the rest of us safe and going. And hats off to you, Dr. Daniel Nagase, for all the work you're doing. And I do know, was Dr. Bruchet involved with serving the RCMP with the investigation on what you served in as well?
Mm-hmm. Yes, that was November 11th on Remembrance Day. Both Dr. Bruchet and we wrote police files to complain that we suspected there was a crime going on in the government of British Columbia, where the health minister, the premier were all involved in a financial conflict of interest by pushing a product, which is the Pfizer vaccine or the Moderna vaccine, and then profiting off of sales of that product because that product makes the share prices of Pfizer or Moderna rise in value. And that's something that a lot of government officials, even healthcare professionals, doctors own Pfizer stock. It's a part of their mutual funds. So many people have that as a part of their RRSPs. So how is it possible that a health minister, the one here in BC is named Bonnie Henry, how is it possible that every time she forces people in British Columbia to take a vaccine, her retirement value goes up? How is that even allowable? And then, so we filed complaints, Dr. Bruchet and we filed complaints against the College of Physicians and Surgeons of BC, the health minister, the premier, and we filed pages and pages of police reports that we suspected this crime was occurring. So that was November 11th. About a month later, I sent some extra documents to the officer who was assigned to the case. And there's only one officer who was assigned to this case. I sent him a copy of that Pfizer post-marketing survey report that was leaked out, that showed all the side effects in the first 3 months that their new product was out on the market, right? And it detailed all the adverse events direct from Pfizer's own file. I haven't heard from this officer who was assigned to this conflict of interest case, right? I've sent him extra information, extra evidence, and nothing but silence. So one officer assigned to the biggest corruption case in British Columbia, the biggest financial conflict of interest case in British Columbia history, potentially. And then all of a sudden, 8 officers sent to the home of an 81-year-old grandfather? Like, how does that make any sense? You have 8 officers to spare to drag an 81-year-old grandfather to the hospital for a mental health assessment, but you only have 1 officer available for potentially the biggest corruption case in British Columbia history.
Wow, that's crazy. So, I mean, with everything the two of you are doing out there, you know, it's hard not to look at this as almost like a silencing operation. We've seen this before. It's nothing new. It's new to our country, but many other countries have done the same thing. One of the easiest ways to discredit somebody is get them into the psych ward. It stops a lot of following. It kind of takes the wind out of their sails, discredits them in probably one of the most easiest manners. It's almost like being in a conversation with somebody, and as soon as they call you a conspiracy theorist, the whole room stops listening to you. And this is the exact same thing.